Ever feel like your mental health medications are slowing your metabolism? If you're on something like olanzapine or Zyprexa, lithium, Depakote, mood stabilizers in general, and the weight gain, the brain fog, or sugar cravings are out of control, this might surprise you. Metformin, a diabetes medication, could be the quiet game changer you didn't know about. I'm Dr. David Danish, a double board certified psychiatrist specializing in child, adolescent, and adult psychiatry. I prescribe metformin to thousands of patients, so let me walk you through what really matters, what works, what's tricky, and what to watch out for. Let me explain what metformin is supposed to do. Metformin is technically a diabetes medication. It lowers blood sugar by decreasing how much glucose your liver pumps out and by helping your muscles use insulin more effectively. But here's why psychiatrists like me are paying attention. Some of our most effective medications like Zyprexa, Seroquel, clozapine, Abilify, lithium, Depakote, all can cause significant and rapid weight gain, insulin resistance, and lead to type 2 diabetes in some people. This in turn leads to all kinds of system concerns, worsening mood, worsening cognition, of course, cardiac dysfunction, on you go. Now, metformin helps reverse that. Clinically, I often use it off-label for reducing weight gain ahead of time from these medications that I know will likely lead to increased appetite, lower metabolism, and therefore increased weight. Some of the side benefits when we do that are lowering inflammation, improving cognition, as well as improving all end organ function. Metformin also has other side benefits. For instance, it is known to help in patients who have PCOS or polycystic ovarian syndrome. It also likely slows aging. It can slow down brain aging and body aging. It's one of the only medications known to humanity that actually prolongs life independent of its benefits on type 2 diabetic patients. So it's one of the few medications out there that supports both the brain and the body, and that makes it a very valuable tool in my opinion. Here are some of the side effects I think you should know about up front. The three big side effects I tend to see most often in my patients are, and they tend to show up early, but often fade or level out with time, stomach upset, nausea or diarrhea, bloating or gas. That is not uncommon at first. It tends to subside in most people, and it tends to be reduced if you take it with a meal. So I usually start at the lowest dose, 500 milligrams at night. That can be divided in half to 250, and I say take it with dinner time. I often will also switch to the extended release version to help with GI tolerance if that's a major concern. Some of the other common side effects that I don't see as much but are listed in research are fatigue, a lower appetite, which of course is not a problem for a lot of people because we're trying to prevent weight gain. And these do usually improve if that appetite reduction is too intense. Now, some rare but serious side effects I want to mention. I have not seen them myself, but I know they exist. So vitamin B12 deficiency in all of my patients, when I start them on metformin, they also start on a basic vitamin B12 vitamin because metformin will block the absorption of vitamin B12 through the intestines. I usually recommend 500 micrograms of vitamin B12 daily. Now, the other concern, again, I have not seen it, but something called lactic acidosis. It's a rare condition affecting fewer than 1 in 100,000 people who go on metformin, but it's mostly a higher risk in those with kidney or liver disease, which is why you should monitor kidney function regularly to make sure the kidneys are working properly. Now, metformin is not known to cause kidney dysfunction, but if something else causes that dysfunction, we need to know about it if you're on metformin. If you want the full list, as you should, of potential side effects, how to manage those side effects, and other things to watch out for, I created a full list plus tips on how to manage those in my free Mind Vault at drdaviddanish.com, and I'll put that link in the description below. So my take on metformin is this. I typically recommend metformin whenever a patient is starting a medication that's known to cause an increase in appetite, weight gain, or general metabolic problems. It is especially helpful for teens, adults who gain weight quickly on various mood stabilizers or antipsychotics. Anyone with a family history of diabetes or metabolic syndrome should also consider it, irregardless of what medications they're going on. Also, women who have PCOS, That's a great consideration there. And then in some cases, there are side benefits, including mental health side effects and brain cognition side effects. So if brain fog is a considerable concern and there are other related risk factors for future metabolic syndrome, you might consider talking to your primary care physician about that. Again, I always pair it with a vitamin B12 supplement, and I often will also add in omega-3s, which are great at reducing triglycerides, another laboratory finding that increases in metabolic syndrome. Think of metformin as a metabolic buffer. It helps your body stay in balance while your brain gets the support it needs. If this was helpful, hit the subscribe button and check out the Mind Vault at drdaviddanish.com. That Mind Vault has tons of free resources on nearly every mental health medication, explained clearly with pros and cons based on my real-world experience with my patients. There are also patient-friendly screening tools and science-backed supplement guides for insomnia, ADHD, OCD, anxiety, mood swings, and much more. Thank you for watching, and I'll see you in the next video.